Hey guys, Dr. Deva here
And Dr. James.
from the 100 Meter Practice. So today we would like to talk about concussion in children. So the sport-related concussion has doubled in children in recent decades. And the symptoms, including some sort of somatic cognitive behavior and physiological symptoms, can actually prolonged after 2 weeks. Most of these symptoms will resolve in 2 weeks, but then one of these cases lasts more than 2 weeks, and we call them persistent post concussion symptoms. And these kids, these children, can result in school absenteeism. So they're at school, but then they're absent-minded, and then they can have a decrease or have impairment in their academic performance, depressions, and also loss of quality of life. So return to sport usually will resolve in about a week or two, and the general consensus is rest is best. And there are some new research that suggests that this may not be the case, or there might be something that we can do to help that. Dr. James.
Yeah, indeed. So in 2019, there was a study released that looked at measuring the benefits of rehabilitative exercise versus our static stretch, or more that rest is best sort of idea.
Yep.
So they found that 48 hours after, if it was done gently, some of that rehabilitative exercise can actually speed up recovery and reduce symptoms, which would then lead to less burden on a child's social life and their social implications, not to mention their academic ability as well.
Yep.
Because again, there'll be less of that absenteeism as they're in class. So one of the ways that this is done is with aerobic exercise. So aerobic exercise is shown to increase the autonomic nervous system and help with cerebral blood flow, the cardiovascular system, not to mention neuroplasticity, which is how the brain learns and regenerates. So more research is always needed around this sort of thing. In particular, they're looking at how the aerobic exercise really helps to build that back up. So they're definitely looking into it. But if you know somebody who has a child who's had a concussion, or if your child's had concussions and you're curious about how we can help, please give us a call, come in. We'd love to have a chat to you and see how we can best help you out. All right, guys, have a great week.